Hi, my name is Mike Tevald. I'm from Arcadia University, and on behalf of my colleague Julie Skrzat and our co-author Sara from the University of Nebraska Medical Center, I'd like to talk to you a little bit about our manuscript entitled "The Application of the Four-Element Movement Model to Cardiovascular and Pulmonary Physical Therapy Practice." Now, movement is central to our profession, but efforts to define a movement system model that can guide physical therapy practice across all settings with all patient populations have been lacking. A few years ago, some faculty members at Arcadia came together to develop the four-element movement model, and we found it to be a very useful teaching tool and a useful guide to clinical reasoning. The model centers on the four elements that are critical for all human movement, and those are motion, force, motor control, and energy. It also acknowledges the impact that environmental factors and personal factors can have on movement performance. Application of the model to clinical practice begins with the selection of a movement task. Now, the beauty of the model is that it can be applied to any task, as basic as breathing or as complex as athletic maneuvers. We observe the task using the observation targets that we use the acronym CAS to illustrate. So CAS stands for control, the amount of movement at the individual joints or segments, the speed, the symmetry, and whether or not symptoms are provoked by the movement. The observation of the movement leads to the generation of hypotheses about which of the four elements might be contributing to dysfunctional movement. And we use our clinical exam to test those hypotheses. The results of our clinical exam are then used to develop a targeted intervention strategy that identifies and intervenes to address the impairments that are contributing to the movement dysfunction. In this manuscript, we use three cases to illustrate how the movement system model can be applied to patients with cardiovascular and pulmonary dysfunction. For example, we have one case of an individual with a heart failure exacerbation who was hospitalized and is having difficulty with transfers and gait. We have an individual with a transfemoral amputation who's trying to increase their endurance using a prosthesis. And we have an individual early on in the rehab following a cervical spinal cord injury who's having difficulty controlling his breathing. We hope that this manuscript illustrates the utility of this four-element movement system model, and we welcome your questions and comments. Thank you.